Snoring and sleep apnea is, a hot topic right now. A big area of research. It's growing. And I think we need to listen to what the research is telling us about how it's increasing our risk for heart attack and stroke, significant increases. So if you know a loved one that snores, usually we hear from the spouse, you need to do something about my husband, he's snoring. First and foremost, we recommend that you see your physician and go get a sleep study done. You need a sleep study done to see if it's just snoring or if it's sleep apnea, and if it is sleep apnea, what kind of sleep apnea? Is it, a central mediated sleep apnea where there's something in your body, in your brain that tells you to stop breathing, or is it an airway problem? We can help if it's an airway problem. The best possible treatment oftentimes for patients, and the most conservative, is to use a CPAP machine. Compliance is a major issue with that CPAP machine, so sometimes we're patients looking for alternatives. Maybe they're considering surgery. We have another conservative option that is maybe the second best thing to the CPAP machine, and that's an oral appliance that repositions your jaw forward to open the airway. It's analogous to when you are getting CPR training and they tilt the head back and tilt the chin. It's the same thing. You're trying to open the airway so that you can breathe, so you don't have those events at night where you stop breathing. We've seen their sleep apnea events be cut in half. We've seen their sleep apnea events be cut by 80%. We never see them cut by 100%. The CPAP machine is probably the only thing that can do that, depending on the severity of the sleep apnea problem. But we have an oral appliance that significantly reduces your risk.